Hello, my name is Joe Lipton. I'm one of the consultant anaesthetists working here at Aria. I'm going to talk to you today about what to expect from your sedation when you come to have your procedure. The way that it works here is that you will first of all be screened by the nursing team to make sure that you don't have any medical conditions that we should know about in advance. Occasionally people are invited for an assessment by an anaesthetist prior to the day of their procedure, but usually people will come in and be assessed by an anaesthetist on the day. We'll go through your medical history, any past experience of having general anaesthesia or sedation, and check whether you've been taking any regular prescribed medications and anything that you've taken on the day. It's important that you follow the fasting guidance that you're provided by the clinic. What that means is that you should have no food for 6 hours prior to your procedure, and you should stop drinking water 2 hours prior to your procedure. If there's something in your stomach at the time that you have your sedation, it can be hazardous. So we always check that meticulously with you on the day and make sure that those timings are followed appropriately. What happens next is that we will bring you inside the procedure room. We'll give you some oxygen to breathe through a face mask, and we'll connect some routine monitoring to look at your blood pressure, heart rate and oxygen levels. We'll then put a small cannula into one of the veins in your arm, somewhere up here or down on the hand. Once we've done that, we'll give you a strong painkiller, and that will make you feel a little bit woozy and relaxed, and we'll follow that up with a sedative. The sedative is given in small doses throughout the procedure to keep you in a state of what's called deep sedation. That means that you're not really aware of what's going on, and it's very unlikely that you'll remember anything about your procedure. What we always tell people is that deep sedation is not exactly the same as general anaesthesia, but it feels very similar. You're not quite as asleep though as when you have a full general anaesthetic. During the procedure, we'll keep you completely comfortable and relaxed, and we'll be sat next to you throughout to keep you in that state until the end, at which point we stop giving you the sedatives and then you wake up naturally. Once we're happy that you're ready to, we'll move you out into the recovery area, and you'll stay there for around about an hour. Initially, when you first get out there, you'll still be feeling drowsy, and it's normal to have some cramping or discomfort after the procedure, which we manage with a variety of painkillers, some that are given at the end of the procedure as suppositories, and if necessary then you can have some additional pain relief whilst you're in recovery. For the next hour or so we'll keep a close eye on you, continuing to monitor you. You'll start to have something to drink, and then you'll be asked to mobilise and go to the toilet. Once we're happy that you're stable and feeling well and any pain is controlled, then you'll be allowed to leave. And it's important at that time that you have an escort with you. The nursing team will give you some specific instructions about how to take care of yourself over the rest of the day and the coming days, and you'll be reviewed by an anaesthetist before you go home to make sure that you're feeling well. All the best and good luck with your fertility journey.